Well, actually, on day 3, we expect less that time in the morning, but now actually you're more than you were yesterday. So welcome back. Yesterday we went more into intermediate and advanced techniques concerning breast imaging. So the first session in the morning was about BI-RADS. BI-RADS, as you already know, it's a very useful tool that keeps us in line most of the times, and it's the best way to communicate between radiologists and clinicians. Then we had a presentation about contrast-enhanced mammography, which actually was very thorough, and I think solved a lot of, the way it was presented actually gave us a lot of answers in all those questions we have, because we are mixed up between tomosynthesis, and that. So I think it was really helpful. Concerning the breast cancer biology, Professor Linos tried to give us the basic knowledge we should have in order to communicate with our colleagues in the MDT meeting. It is true that you can never learn enough of that. Professor Durante gave us some ideas of application of the ultrasound for staging concerning the surgical strategy, and it is true that nowadays more and more surgeons, we do use intraoperatively the ultrasound because it helps us really well in estimating the clear margins in wide local excisions at least, or of course finding up non-palpable lesions. You had an update from Professor Kleanthis about the surgical techniques. Nothing has changed the last years, unless, of course, the oncoplastic that is getting more and more into our hands, and it's really nice for women. Women love oncoplastics. We had, again, the update on ultrasound-guided interventions, and then, of course, you had hands-on on the workshops, and there are more workshops for you today. This was a very important lecture concerning the correlation between the clinical expectations when you perform a core biopsy and the results that you have. This is actually the main question when you assess a patient with core biopsy. If the results you get from your pathologist are what you expected when you examine the patient. So there should be a concordance between clinical estimation, imaging, and pathology, which is actually the main issue in all breast assessment. Chemotherapy, not so many advances since the last years, but in general, chemotherapy is much more tolerated now, but the idea again is to be tailored to each specific patient. Radiotherapy is getting better, with best localization techniques, we have less and less complications after that. Professor Durante also reported the sick lobe concept, which is pretty much something that surgeons we do, but maybe some of us didn't know exactly the literature behind it, but most of us we do. So today, the first session, it's concentrated on dense breasts, which is a nightmare. Dense breasts is the foggy area that we are all afraid of, and this is actually where we may miss most of the undiagnosed cancer. And then we'll have a short update on surgical solutions after neoadjuvant chemotherapy, a short update on the axilla treatment, which is trying to get simpler and simpler by time. We discuss about advanced MRI techniques, so we have a quick look into the future, and at the end we'll just have a chat with Professor Aribal on imaging of high-risk lesions and follow-up schemes for all those things. At the end we'll just give you a brief about the test, but some of you have already taken the post-test, thank you, and the scores were excellent, so that means we achieved something those 3 days, you achieved something those 3 days. So, okay, the test is easy, no worries about it, and you have unlimited tries, so don't take it too seriously. It's mostly for you. Okay, of course, it is for us because we get some feedback on what happened those 3 days, but it's most important for you trying to put all those things you heard in 3 days in order.